members of the Presidential Task Force, distinguished ladies and gentlemen of the press, our sincere apologies again for starting this briefing late. We had quite a lot of issues to deliberate upon. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 6th of August, 2020. For the past 9 weeks, precisely from 2nd of June, 2020, we've been running the phase 2 of the ease lockdown, which has witnessed 2 extensions. These extensions were necessitated by the observed lack of compliance with prescribed measures, dangers associated with community spread infections, and the need to strengthen critical areas of the response strategy for effectiveness. Prior to the Salah break, the Presidential Task Force informed the nation that the 6th interim report and the recommendations would be submitted to Mr. President for his consideration and approval. I'm therefore pleased to inform you that the PTF team met with the President on Wednesday, 5th August 2020, to appraise him of the situation on COVID-19 and the next steps. Suffice it to state that the recommendations made to the President have been born out of diligent evaluation of the situation in Nigeria, as well as regional and global experiences. Our considerations were also guided by 3 thematic areas, namely 1, movement, 2, industry and labor, and 3, community activities. The Presidential Task Force, within the same period of reporting, prioritized the following areas of major focus for the extended second phase of the response: using data and science to inform decision making, improving the efficiency of the response activities, emphasizing personal responsibility of individuals in preventing transmission, and supporting the healthcare system and strengthening the adoption of non-pharmaceutical interventions. But before I unveil the details of the next steps in our national response, the Presidential Task Force finds it necessary to take you through a review of our situation. Domestically, in the last month, the number of states with over 1,000 confirmed cases increased from 4 to 10 and the Federal Capital Territory. While Nigeria has conducted 43% more tests in July than was done in June, the positivity rate has also decreased, showing the progress made in access to testing. Likewise, our case management efforts have also seen a reduction in the fatality rate from 1.9% in June to 1.7% in July. Community transmission is increasing, as reflected in the fact that, as of today, 536 local government areas out of the 774, equivalent to 69% of the total, have reported a COVID-19 case. Figure 1 below, which they would show up on the screen there, depicts the EP curve of COVID-19 in Nigeria, with slight declines from July 28th, 2020, while Figure 2, which is the map of Nigeria and differentiates, shows the confirmed cases by states and approximate numbers. The Presidential Task Force has used this data to help guide response and inform the policy policies it has recommended. We have also found it necessary to bring you a month-on-month comparative statistics for similar dates, 4th July and 4th August, to enable you capture the new developments worldwide on the continent of Africa and in Nigeria. Though the pictures are not very sharp and you can't see the figures from there, but by the time you get a copy of my speech, you see the glaring figures. But permit me to draw your attention to the global cases as of 4th of July, 2020. The global figure stood at 10.9 million cases globally. As of 4th of August, that figure jumped exponentially to 18.142 million. In terms of absolute figure, we recorded an increase of 7.220 million in just 1 month globally, representing 66% of the infections. On the continent of Africa, as of 4th July 2020, the recorded cases stood at 342,415,000. On the 4th of August, on the African continent, the number had jumped to 825,272 cases. In terms of absolute figure, we have on record 482,857 cases in just 1 month. And in terms of percentage, that percentage stood at 141% in terms of growth. In our country, Nigeria, as of 4th of July 2020, our statistics shows that we had 28,167 cases. By the 4th of August 2020, we have recorded, in terms of number of cases, 44,433 cases. In absolute figures, within a period of 1 month, we recorded 16,266 cases, representing 58%. And in the same vein, if you look at the percentages, the figures of fatalities globally, on the same day, 4th July, the record shows 523,011 fatalities. On the 4th of August, the figure had risen to 691,013 fatalities. In absolute figures, we recorded fatalities in 1 month globally of 168,002 persons day, representing 32%. Similarly, on the African continent, in terms of fatalities, in the month of July 4th, the record shows 6,628 fatalities. In the month of August, that figure jumped to 14,139 fatalities. And in terms of absolute figures, the record shows 7,511 in just 1 month, representing, in terms of percentage growth, 113%. In our country, Nigeria, 4th of July, fatalities stood at 643, while on the 4th of August, that figure rose to 910. In terms of figures, absolute figures, we recorded in just this 1 month 276 deaths, representing 44%. I've taken time to give you this picture so that we have an appreciation of the magnitude of the ravaging effect of COVID-19 globally, on the African continent, and in our country, Nigeria. The world continues to be confronted with the reality of the new normal foisted on all humanity by the outbreak of the coronavirus pandemic. The virulence and novelty of the virus has made it compelling for humanity to work together, to put in place strategies to contain its spread and ensure that the delicate balance between dealing with the pandemic as a public health concern and guaranteeing livelihood is maintained. The details of the above data guided our national response and informed the policies put in place, which played key roles in recording the following successes. 1. Use of data and technology in improving surveillance, contact tracing, and testing efforts. And 2. Significantly increasing testing capacity with the activation of 60 laboratories in 31 states and the Federal Capital Territory, as well as the accreditation of several private health laboratories into the system of the testing, doubling the number of tests taken within a month from 130,000 to 304,221. And 4, increase risk awareness through collaboration with traditional, religious, and community leaders, as well as other partners. 5, ensured longer collaboration and partnership with the legislature. And 6, successfully evacuation of over 8,000 stranded Nigerians abroad at minimal cost to the government. Continued strong coordination with the private sector to mobilize resources for the response. And 8, mobilize more partner support for the response at the state level. 9, join the global community in the critical trials for vaccine ahead of a potential mass deployment. And 10, laying the foundation for homegrown research activities for a domestic cure. And 11, develop guidelines to support the safe reopening of other sectors of the economy. And 12, providing technical support for the development of incidents action plans, IAPs, for the states. And 13, holding regular consultation with the state governors, commissioners for health, and other related sectors. Our assessment has also revealed that the foregoing accomplishments and plans notwithstanding, the following challenges continue to pose considerable concern. And the first of such challenges, the increased non-compliance with pharmaceutical prevention measures. The second being lack of enforcement of necessary guidelines issued to preserve lives. And the third, the insufficient engagement by some states with the national response, and the lingering concern about the gap between identified cases and the actual burden of the disease. And lastly, apathy, fatigue, and disbelief, combining to challenge public engagement, compliance, and behavior change. distinguished ladies and gentlemen, to address these challenges and continue improving our national response to eventually win the fight against the pandemic, the Presidential Task Force reached the conclusion that for Nigeria, it is important to ensure that restrictions are not completely relaxed in order to control and abate further community transmission. It is also important that at this community transmission phase of the pandemic, subnational governments set up to take more responsibilities by owning the response and the process. To sustain gains already made, therefore, the Presidential Task Force recommended to the President the further retention of the current phase of the response with minor changes or adjustments to address economic, socio-political, and health concerns. These measures are further outlined in the guidelines, which the National Coordinator will elaborate more extensively on. It is, however, important to inform you that major changes being proposed are aimed at achieving the following: gradual reopening of international air flights within established parameters, reopening of rail transportation within established parameters, which was undertaken on the 29th of July 2020, and also continuation of the permit granted to exit classes to resume ahead of examinations, particularly the West African examinations and other examinations as provided for by the Federal Ministry of Education, and now further allowing civil servants from grade level 12 to resume work who would provide essential services for the workings of the public sector. And finally, opening recreational parks for supervised exercises. After due consideration of the recommendations, Mr. President has approved the following: maintaining the current phase of the national response to COVID-19 for another 4 weeks in line with the modifications reflected in the report, the 6th interim report we submitted, which the National Coordinator will give you further details on. B, partnering with states and local governments to improve community sensitization and engagement to the COVID-19 response. And C, mandating state authorities and the Federal Capital Territory to enforce non-pharmaceutical guidelines, primarily the use of face masks in public appearances and places. D, encouraging state governments to collaborate with the local government authorities to intensify necessary measures such as contact tracing, grassroots mobilization, and risk communication. And finally, E, strengthening of collaboration with other mandate groups at the federal, state levels to harmonize the country's COVID-19 response on the short, medium, and long-term basis. Before I round up, I wish to remind all Nigerians that this fight is for every one of us, and that you must take responsibility for your actions or inactions. Disbelief and skepticism will further complicate our situation, and we should not stigmatize anyone infected. Our communities should own the response and continue to educate our citizens about the need to keep themselves safe and to take personal responsibility for their actions. It is now my privilege to invite the National Coordinator to provide the details of the revised guidelines. I thank you so much for your kind attention and have a good evening.